Hi everyone, I'm Dr. Stephanie Sarkis. I'm going to be answering some of your questions about having anxiety around COVID-19 or coronavirus. I know a lot of people have emailed me and called me and written to me that they're having some pretty crippling anxiety about possibly contracting the virus. How do you avoid it? So we're going to talk a little bit about, or I don't generally tend to refer to myself in the third person, but you and I are going to talk about how to help with some of your anxiety and what's a realistic anxiety and what could be what's fact versus speculation, basically. Because I think one of the things that I tend to work with people on when we talk about anxiety is what's fact and what's speculation. Because when you have an anxious brain anyway, your anxiety can your brain can kind of run with that anxiety. So we're going to talk a little bit about what the facts are and then what the speculation is. I think that part of the anxiety stems from that the government has not done enough as it should have done to put preventative measures into place. And I think that has led to people's anxiety increasing, and also the fact that that the government's also put a ban on some people in the CDC speaking without permission, which is a level of censorship we haven't seen before. So I think that's actually increased people's anxiety. So we're going to go a little bit into how to help with your anxiety. First, make sure you're taking extra good care of yourself. It may be hard for you to sleep right now, but get as much sleep as possible. And also keep up your routine. So if you exercise, just keep doing that. Especially because that boosts dopamine and your dopamine's low if you have anxiety, keep doing all the stuff you used to do. Now, maybe if you go to somewhere like at work, I'm not shaking hands with people right now. And the way I address that is I just say to them, hey, I'm not shaking hands, sorry. And so far, people have actually appreciated that. So there are little things you can do. Carry some hand sanitizer. If you can't get hand sanitizer because it's sold out everywhere, I think that lends to some more panic too. I know in where I live, there was a run on toilet paper, and I'm not sure exactly why, but I think that you live in a hurricane-prone area, that's one of the things people go to buy. So people are going after toilet paper. I'm not sure how it's going to help with COVID, but keep in mind that also we get this kind of community panic. So by ourselves, we can be pretty rational, but when we're in other people and stuff flying off the shelves, we tend to get caught up in that. So look at whether this is a individual fear you're having or it's part of that group feeling you get where when someone's doing something, you see another person do something, then all of a sudden your brain kicks into gear. And that makes sense from a biological evolutionary perspective, that we tend to panic when we see other people panicking because we figure there's something that's worth panicking about, right? So it makes sense for your brain to do that. But also we have the ability to say, wait a second, am I panicking because people are getting stuff off the shelves, or is this something that's a fact? Is this something that that you really have a basis in anxiety for? Because anxiety isn't a bad thing in itself. So we need anxiety. For example, when you're going to cross the street, you need to have some kind of anxiety so you look both ways before a car's coming. Or you need anxiety when you have a high pressure job like being a pilot. You need some anxiety to make sure that you go through your entire checklist and everything's going okay. So anxiety by itself is actually a helpful thing. It's just when it goes off the continuum into affecting your quality of life, and that's when it becomes an issue. So first, keep in mind that the stuff that you do during flu season, you just want to continue doing that now. So that could be that you wash your hands more often, and you want to wash your hands appropriate period of time. There are several videos on there. I think it's you want to do the ABC song. That's the length of time you should be washing your hands. So we want to make sure we wash our hands. Also use hand sanitizer. And I know if you've run out of hand sanitizer where you live, I've been told if you just add at least 70% alcohol solution to aloe gel, that creates a hand sanitizer. And it has to be 70% alcohol because otherwise it doesn't evaporate, and that's what you're going for. I'm still doing some traveling, so I'm bringing Clorox wipes, which is what I usually do when I travel. So I just wipe down all the handles and all the phone and in the hotel room, and I just wipe everything down with a Clorox wipe first. And also face masks. If you're going to wear a face mask, make sure it's a good quality face mask. Some of the face masks out there aren't that great of quality. And be aware, just if you fly on a plane, that you may have people with allergies next to you. I mean, it's allergy season right now in Florida and Tampa Bay. And I've been telling patients when they come in that, I'm sniffling because I have allergies. So just be aware that not everybody coughing or sneezing has a virus. It could just be that they have allergies, and that's a really big issue right now. So I took my allergy medicine. I'm still kind of snorky, I call it, and I sound like I'm congested. So that's allergies, because I haven't been in contact with anybody that has tested positive at all. So I keep that in mind, that it may also appear to you more often like people are sick, and that's because we're paying more attention to it. So also, looking at my notes, if you are anxious about COVID-19 coronavirus, you're probably already taking precautions that you need to take. So keep that in mind, that you're probably already a step ahead of other people as far as protecting yourself. But try not to isolate yourself too much, because isolation tends to increase anxiety. So make sure that you're still going on doing the things you usually do. Maybe just take some more precautions. I've read that if you go to the gym, if you're on the treadmill, just wipe off the treadmill with, I know a lot of gyms have sanitizing wipes. Just wipe down the treadmill beforehand, like the keypad and stuff. And that's probably just a good idea anyway, especially during flu season. Also, the news can, it's helpful, but also they can tend to give you more information what you need, because we really just need the basic facts of stuff. So there's a YouTube channel. It's Dr. John Campbell, and I like his channel. I refer people to it because he's very fact-based about COVID-19 coronavirus, and I like his channel because he just tells you the facts. And I think part of the issue with news is that, again, they give you the facts, but I think also it can be done in more of a sensationalized kind of style. That's my undergrad degrees in telecom production, and I know that on the news there's a lot of repetitiveness too. For, again, good reason, because people need to know information. But I think also there can be a sensationalized aspect to it. And when someone without anxiety sees someone with COVID-19 being interviewed with coronavirus, if you don't have anxiety, you tend to kind of just be like, okay, that's somebody with it. But when you have anxiety, that can keep you up at night if you've seen people being interviewed that have it. So I would say just go to Dr. John Campbell's YouTube channel. I find that very helpful, and I find that people that have anxiety, when they go to that channel, they're not having as many issues with anxiety, because he gives a really good perspective on it, and I think he uses a lot of factual-based information. So that's Dr. John Campbell. So also remember, there's only so much that we have control over. That, and also I'm going to tell you something that I think it may increase your anxiety, but I think it might actually decrease it too. That you can have people that test positive that never show any symptoms of it. And I'm telling you that because if you get the virus, you may not actually get sick from it. There's a chance you could, but there's a chance you couldn't. And so I want you to keep that in mind too, that if you have not been immunocompromised, if you are generally pretty healthy, this should be like a little like a harsher version of the flu. And I've had the flu anyway, and it's horrible. But if you are generally pretty healthy, you should be okay if you do get it. But I think that you are taking precautions, and again, there's only so much control that we have over things. And I know that when you have anxiety, you like to have control over a lot of things, but there are some things you just don't. But what I don't want you to do is isolate yourself, except again, if you have to self-quarantine, but someone tests positive. But if you just go about your daily routine, I think you'll find that you'll be okay. And it's important to just go outside. And again, if you don't feel like you want to go to an event because there's people there, then don't go, and that's okay. I don't think anybody can fault you for that at all. But just make sure that you're still doing your regular stuff that you do. And again, take really good care of yourself. Make sure you get enough sleep. Practice some mindfulness meditation. So if you find that your brain's running away from you, I recommend that you name 3 things you can see, 3 things you can feel, and 3 things you can hear. And repeat that until you feel kind of like you're back down to baseline. So it's name 3 things you can hear, 3 things you can see, 3 things you can feel. And again, you're probably not going to get COVID-19 or coronavirus. Again, some people may test positive for it and they don't get symptoms to it. So again, keep up your routine, practice good self-care, make sure that you're just getting factual information about COVID-19. Again, the YouTube channel I recommend is Dr. John Campbell. He does videos sometimes even twice a day where he gives updates, and I like his videos because, again, they're very factually based. Also, turn off the news too. So get your information, then turn it off. We know that just like any other virus, that COVID-19, the more people that have it, the more people get it. And that's just part of life. That's just the way the virus forms. That's the way the flu works. So again, treat this just like you would a flu season. Also, again, there's only so much control we have over things, and you're probably going to be okay. Probably going to be okay. And again, that may not make you feel comfortable right now, but I think that if we take really good steps at practicing good self-care, again, making sure we get enough sleep, because sleep is one of the ways the body beefs up its immune system. So make sure you're getting enough sleep. And talk to your doctor if you're really not sleeping and having a hard time. You may need some medication just to help you sleep, at least get you in the habit of sleeping again, because when you're not sleeping, it's even more difficult to make decisions and it's difficult to think clearly. So talk to your doctor if you're really having some anxiety about sleeping. So I think that pretty much sums it up. So again, just continue to keep taking good care of yourself. Make sure that you are just practicing regular caution. And again, I'm not shaking hands with people, and I just tell people I'm not shaking hands right now. And again, they've all appreciated it. So keep some hand sanitizer on you. Use Clorox wipes if you're traveling and you go to a hotel room, just wipe the room down. And again, we only have control over so much. So, and again, limit how much news you're watching and what news you're watching. So again, go to YouTube channels that are just based with, that are evidence-based, like Dr. John Campbell and other sites that just use research scientific data. So, and again, I think you're going to be okay. This is something that unfortunately happens sometimes, and I think that, again, the part of the reason why we're having a high level of panic is that we weren't as prepared. The federal government wasn't prepared as they needed to be and did not respond as effectively. So that's part of the reality, and I think that we do have a realistic fear with that. But again, I think that we need to try to keep up our normal routine as much as possible. And again, just exercise some caution. So, and realize that some people are going to be asymptomatic. They're going to have test positive but not have the symptoms. And and again, that's meant to actually help you, not scare you. If that scares you, just be aware that, you may test positive and never get the symptoms from it. That happens. So that's just a little bit of an update on how to deal with anxiety from COVID. So self-care, really, really important. If you're talking to kids, you just tell them this is just like a flu bug and that sometimes bugs go around and you catch them. You want to keep this as low-key as possible, depending on your kids. So some kids, you can give one kid information, they're fine with it, and another kid doesn't sleep for a few days. So ask your kids what questions they have before you answer them, because I think sometimes we tend to over-explain. So they may just want to know what it is. And you can just say, well, it's a virus that sometimes bugs. I don't know if you want to use the word bugs if your kid likes bugs, but, in case they don't get turned off to bugs then. But you could just say this is just a thing that goes around sometimes, just like flu season, and they are probably aware of flu season that goes around school. So again, I think you're going to be okay, and just take good care of yourself.